Now to the new option for mothers that are giving birth. It's called a gentle C-section, and advocates say it can change the entire experience for the mother and also benefit the baby. ABC's Ariel Reshef is here, and you're going to take a look at this for us?
Yeah, it's really interesting. So imagine aromatherapy, soothing music, right? A quiet ambiance. Sounds more like a spa maybe, not an operating room planning for a C-section. The gentle C may be the same surgery, but it's a new way to bring baby into the world, and one mom let us in on her journey.
A growing trend making its way to maternity wards across the country. Gentle C-sections giving moms a more mindful and memorable way to give birth.
Really looking forward to being able to hold the baby right away.
Tara Martinez had her first son by emergency C-section.
It was a pretty traumatic experience.
For medical reasons, Tara knew baby number 2 would also be born via cesarean, but she wanted a different experience. So her doctor at Northern Westchester Hospital recommended the Gentle C.
The gentle section is the same technique, but it's really a state of mind. We try to incorporate mom into the entire process.
C-sections are one of the most common surgeries in the U.S. More than 1.3 million are performed each year. It's still the same operation, but the Gentle C is now an alternative approach more doctors and moms are embracing.
The requests for this type of concept have absolutely increased over the years.
Minimizing chatter in the OR to hear baby's first cry. Giving mom a choice of music and aromatherapy. And another clear difference, trading out that traditional blue drape for a see-through one. It's a practice pioneered at Brigham and Women's Hospital in Boston.
What was it like to look through that clear drape and see him come out?
It was amazing. With my first, I don't really even remember meeting him for the first time. So this was totally different.
Tara's birthing team walked us through another modification, putting the monitors away from her chest to allow almost immediate skin-to-skin contact.
You didn't have it with your first son.
Right, you're carrying this baby for 9 months and the first thing you want to be able to do is hold him. And that's what I was able to do. Definitely felt more of like childbirth as opposed to just having a surgery.
You're gonna smile? Almost. Yay!
Looking back on little Landon's birth, Tara says those small changes made all the difference.
It's just as great of an experience as, you know, giving birth. You get to meet your baby at the end, and that's the main thing anyways, right?
Well, and look what you have to show for it.
Yeah, absolutely.
There it is.
And doctors we talked to say so far they don't see any downsides to the Gentle C, but there are plenty of benefits. They recommend talking to your doctor ahead of time to make a birth plan. The modification should not cost any more than a traditional C-section. In fact, many hospitals already are making this common practice. Robin?
Ariel, thank you. We're going to talk to our doctor, Dr. Jen, about this. You have done hundreds of these C-sections.
Yep.
This is major surgery. Take us into the OR from a doctor's perspective.
Well, first of all, we have to remember this is called a laparotomy. We're going into the abdominal cavity. With an average C-section, there is about a liter of blood loss, so it can be a messy scene. And there are a lot of people in an OR. There are 2 surgeons, there's a scrub nurse, there's a circulating nurse, there are 1 or 2 anesthesiologists, and there's a nurse and possibly a pediatrician there for a baby. So it could be 9 to 10 people before you even count the patient and her partner. This is not like a nail salon. This is an operating room, and we follow formal surgical procedures largely for patient safety, and that's how we're trained.
So tell me about this Gentle C-section. What do you think about this?
Listen,
is it better for the baby?
I think it's largely a PR campaign, and really it does not change any of the safety procedures, and it needs more research. But in theory, there can be some benefits for the baby and the mom. It can facilitate bonding, it can improve breastfeeding, it can reduce infant crying, it's less stressful for the mother and the baby, and it's less surgical. And these, small changes like a clear drape, they don't affect what we're doing as surgeons.
Okay, and as you said, it's very crowded in there to begin with.
Exactly.
So what if the loved one doesn't want to be in there?
Well, this is what I tell people all the time, Robin. I love being in an operating room. Most normal people don't want to be in an operating room. So to have a degree of fear or anxiety, what if I see something? What if I feel sick? What if I'm going to pass out? Those are real, and we are used to that. The concern is that we don't want the partner to pass out and then detract our attention away from the 2 patients we're caring for, because we're not just going to step over that that person.
Sure.
So the tips I recommend, if you're going into the OR, look at the mom, not the room. Just keep your eyes fixated on the mom. You can loosen the surgical mask so you're not breathing in your CO2 and it can kind of make you faint. You can actually turn your back to the OR table and again avert that. And then if you don't feel well, tell the nurse or doctor next to you, because that feeling does not go away. It ends with someone passing out.
And quickly, other things being done to ease the birthing process?
Oh, absolutely. We're always making this more home-like, and as long as everything goes smoothly, we are all for that. If mom or baby has an emergency, we get real serious real fast.
Love it. Thank you. Thank you,
Robin.
Jen. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.